I'm Dr. Ao. I'm a radiation oncologist, and I work for the Island Cancer Center. I've been treating patients at the Island Cancer Center for over a year. Next slide. Today I'm going to talk about cancer and talk about 4 specific preventable cancers or 4 preventable causes of cancer, and then I'll talk a little bit about radiotherapy. Next slide. There are about 200 different types of cancer. And according to the National Cancer Institute in the US, about 40% of the population will at some point get cancer. And among those cancer patients, about 50 to 60% of them will receive some sort of radiation during the course of their treatment. Next slide. There are 10 hallmarks of cancer. The first one is uncontrolled proliferation, which means uncontrolled growth of the cancer. Second is it can evade the growth suppressive effects of the body, meaning that they inhibit certain tumor suppressor genes so that the cancer will not be suppressed. Third is it resists apoptosis. Apoptosis is another word for programmed cancer death or programmed death. It's used to eliminate badly damaged cells, and cancer cells can evade that mechanism of cell death. Fourth is cancer cells can develop and grow indefinitely. In the 50s, Dr. Hayflick demonstrated that normal cells can divide about 50 times and then they'll die, which is called the Hayflick limit. Cancer cells have evaded this limit and can divide indefinitely. Fifth is angiogenesis. Cancer cells can induce blood vessels to form to grow into the cancer cells so that cancer can receive nutrition and channel out waste products. Next slide. 6, which is the most important of all the hallmarks, is the ability to invade and to metastasize, which is to spread, which makes cancer so difficult to treat and to cure. Next is genetic instability. Cancer cells are inherently unstable. They can mutate more easily than normal tissues. 8 is usually cancer cells elicit inflammation from the body. 9 is cancer cells have different types of energy metabolism. It uses glucose differently, less effectively than normal tissues. And finally, it can evade the immune system. Next slide. Why do cells go bad? Normal cells have tight controls, tight checks and balances to maintain homeostasis or the normal state of affairs. But cancer cells have circumvented this check and balances through a series of mutations. It's estimated on the average that 6 genetic faults are needed to create cancer. But if you examine cancer cells, you'll find hundreds of genetic mutations, but only a few are key to become cancer. And among the cancer cells, there's less than 1% of the cancer cells have stem cell properties, meaning that they can generate and divide indefinitely. Next slide. What are the causes of cancer? First, genetic. About 5 to 10% of the cancer are due to inherited gene defects, inherited from the parents, predisposing that person to certain types of cancer. The rest are due to external factors, radiation from the sun, radon gas, diagnostic X-rays, or carcinogens from chemicals, alcohol, smoking, betel nut, asbestos, etc. Next slide. Other agents that can cause cancer are agents that cause or stimulate cell division, like estrogen in breast cancer and androgen or testosterone in prostate cancer. Certain types of infection can also cause cancer, like bacterial infection, H. pylori causing stomach cancer, and certain viral infections, HPV virus causing cervix cancer, and hepatitis B and C virus causing liver cancer. And finally, impaired immune system, patients with AIDS or organ transplant recipients with subdued immune response. Next slide. The following 3 slices summarizes the incidence, the mortality of the common cancers on Guam, according to ethnicity. So nasopharynx cancer is more common in Southeast Asia. It is more common among Chamorros and Asians. Oral cancer, most often due to betel nut chewing among Chamorros and Micronesians. And for the Caucasians, it's usually due to smoking and drinking. Liver cancer, due to hepatitis B and C among Chamorros and Micronesians. Next slide. Lung cancer from smoking, affecting most of the population. Colorectal cancer, breast cancer, prostate cancer are more common among Chamorros and Caucasians. Next slide. Pancreatic cancer more common in Asians and Caucasians. Cervix cancer affects most of the population due to HPV virus. Leukemia more common in the Chamorros and the Caucasians. And finally, non-Hodgkin's lymphoma more common among Filipinos and Caucasians. Next slide. This is an important conceptual slide. It summarizes the different prevention of cancer: primary prevention, secondary prevention, and tertiary prevention. And the green line represents the lifeline of cancer. So before a cell becomes cancerous, it is exposed to elements that cause cancer over a long period of time. And if we can eliminate those agents that can cause cancer, then we can prevent cancer from happening. It's called primary prevention. If, unfortunately, cancer happened, before the cancer becomes symptomatic, meaning that the cancer is too small to be detected ordinarily, that's where early detection and screening will help. That's called secondary prevention. When the cancer becomes symptomatic, that's where treatment comes in. That's tertiary prevention. Next slide. Today I'm going to talk about 4 preventable cancers. They're lung cancer caused by smoking, oral cancer from betel nut chewing, liver cancer from hepatitis B infection, and finally cervix cancer from HPV virus. Next slide. Conversely, smoking causing lung cancer, betel nut chewing causing oral cancer or mouth cancer, hepatitis B infection causing liver cancer, and HPV infection causing cervix cancer. Next slide. First, lung cancer. Next slide. Lung cancer is the leading cause of cancer and cancer death worldwide. In addition to causing lung cancer, it can cause a lot of other cancers, including cancer of the esophagus, larynx, mouth, throat, kidney, bladder, pancreas, stomach, and cervix, as well as acute myeloid leukemia. A recent Canadian study estimated that the lifelong cancer risk for male smokers is about 17.2%, and for females, 11.6%. That means about 1 out of 6 male smokers will get lung cancer, and about 1 out of 9 female smokers will get lung cancer in their lifetime, versus a little over 1% for non-smokers. Next slide. And these are the harmful effects of smoking. On the right-hand side is the different cancers that can be caused by smoking. On the left-hand side is the variety of chronic illnesses that can be caused by smoking. Next slide. Unfortunately, Guam has the notorious statistics of having the highest per capita smoking consumption among all US states and territory. I think that number is probably skewed in the sense that a lot of the cigarettes are bought by the Japanese tourists. So the number may not be as high. And adolescents who use e-cigarettes are more prone to smoking when they get older. Next slide. What is the benefit of quitting smoking? For someone who smokes, for example, 2 packs a day, the risk increases slowly, but at age 50, if they quit smoking, the risk gradually decreases in time. However, if they continue to smoke, the risk of getting lung cancer dramatically increases as he gets older. Next slide. Lung cancer can be treated with radiation, surgery, or chemotherapy. Here's one example of a patient that we are treating. This is the lung cancer in the back, in the posterior aspect of the left lung. And the color lines shows where we are depositing the radiation. And if the cancer is found fairly early, the prognosis is reasonably good. Next slide. Here's another picture of the same patient where the cancer is, and that's where we give the radiation. We can give the radiation very precisely and not affecting the other organs very much. Next slide. Oral cancer and betel nut chewing. This is an example of how we examine the oral cavity for oral cancers. Next slide. The areca nut, commonly known as the betel nut, is the nut or seed of the areca palm. It is chewed as a mild stimulant. In Southeast Asia, Taiwan, and New Guinea, betel nut chewing with or without tobacco, along with smoking and alcohol, are the predominant causes of oral cancer. The International Agency for Research on Cancer has concluded that betel nut is a carcinogen. Next slide. This is an example of the areca palm tree, which you can see all over the island, and this is the betel nut. Next slide. There's a close-up of the betel nut. It's hard to imagine that something so beautiful is so harmful for you. Next slide. This shows the different chemicals that betel nut has that can be carcinogenic and bad for your health, and I'm not going to that in detail. Next slide. The Micronesians have been chewing betel nuts for centuries, and the Chamorros usually chew them either with or without lime, with or without the leaf. Betel nut addicts are about 28 times more likely to get oral cancer or mouth cancer, and chewing the nut with lime and tobacco also increases the risk of oral cancer. Next slide. In New Guinea, they have, unfortunately, the highest risk of oral cancer in the world related to betel nut chewing. And there's a blanket ban on the sale and use of betel nut in their capital since the beginning of this year. And fines are imposed on those violators. Next slide. So about 3 weeks ago, they have the No Betel Nut Chewing Day, and this is the walkathon in New Guinea. Next slide. In Taiwan, betel nut chewing is also a problem, and they estimated that 6,000 people developed oral cancer in Taiwan due to betel nut chewing, and over 2,000 people died from oral cancer from betel nut chewing. So on December 3rd, they have their National Anti-Betel Nut Day also to deter betel nut chewing. Next slide. Here's a patient that we have treated. He had betel nut. He used to chew betel nuts. This is the cancer that developed. Next slide. This is how we treated him. The color line shows where we deposit the radiation, encompassing the tumor and not affecting the rest of his mouth and throat. Next slide. And after the treatment, the tumor sort of disappeared and responded very well. Next slide. Liver cancer and chronic hepatitis. Next slide. Liver cancer is the second leading cause of cancer death worldwide. So it's a very common cancer worldwide. In Asia, most of the liver cancers are due to hepatitis B and C. And in high incidence areas, hepatitis B is the predominant cause of liver cancer. And the relative risk of liver cancer among people with chronic hepatitis is 63 times higher. Next slide. Here's a graph of the various incidents of hepatitis on Guam. I'm missing the hepatitis C, but as you can see from the blue column, the highest incidence is due to hepatitis B, which affects the Chamorros, Micronesians, Filipinos, and Asians, and very rarely affects the white people. Next slide. Hepatitis B is vaccine preventable. It has been available since 1982 and is the first vaccine against a major human cancer. Hepatitis B is 95% effective in preventing infection and liver cancer. Next slide. Usually, babies who are infected with hepatitis B infection, up to 90% of them will go on to develop chronic hepatitis. And among those 25%, up to 25% with chronic hepatitis B would die from either cirrhosis or liver cancer. And liver cancer is a very high mortality rate. Next slide. In Guam, the vaccine is available since 1988, and these are the recommendations that all infants should be vaccinated against hepatitis B, and also universal screening of mothers, of pregnant women, I should say, for hepatitis infection. And for infants born to infected mothers, they should get the hepatitis immune globulin and hepatitis B vaccine within 12 hours of birth to reduce the risk of infection. And children younger than age 19 who did not get the vaccine should get catch-up doses of the vaccine. Next slide. This is a busy slide. Basically, it says that patients or people with high risk for getting hepatitis B should get vaccinated. Next slide. Here's a patient we have treated. He had liver cancer that has spread to the middle of the chest, right here in the sternum. And you can see the tumor there. Next slide. Here's how we treated him. This is the tumor, and this is the radiation avoiding the lung and the heart underneath. Next slide. Here's the side view. Tumor, we have treated it. That's how we give the radiation avoiding the heart posteriorly, and he responded very well to the radiation treatments. Next slide. Cervix cancer and HPV infection. Next slide. Cervix cancer is the second most common female cancer worldwide, and human papillomavirus, or HPV, is detected in virtually 100% of cervix cancers. And HPV 16 and HPV 18 accounts for 70% of the cervix cancers. Next slide. About 80% of all women have a lifetime risk of infection of HPV. So 80% of women in their lifetime will get HPV infection sometime in their life. Next slide. HPV is the most common sexually transmitted infection. And at any point in time, a recent study showed that at any point in time, about 40% of the women have genital HPV infection. And about 10% of women infected with high-risk HPV will go on to have persistent infection and put them at risk for cervix cancer. Next slide. This is a natural history. This is a diagram showing the natural history of cervix cancer. The HPV virus infected the cervix, but over 90% of the time, the virus is cleared from the body. But for those people who got the high-risk HPV infection, 10% will go on to have chronic infection, and about 10 years later, develop invasive cervix cancer. Next slide. HPV virus not only causes cervix cancer, it can cause other cancers, including cancer of the anus, cancer of the vagina and vulva, penile cancer, and mouth and throat cancers. Next slide. This is the these are the different HPV viruses that can cause cervix cancer, but the two most important ones, or most common ones, are the HPV 16 and HPV 18. Next slide. There are two vaccines we can use against these viruses, against HPV 18 and HPV 16, and they both consist of 3 separate injections. Next slide. Who should get the vaccine? Girls aged 11 to 12 should all get vaccinated. For those who are 13 to 18, if they haven't gotten the vaccine, should get vaccinated. Young women aged 19 to 26 should talk to their doctor about the benefit of getting HPV vaccine. Next slide. The vaccine is very safe. It doesn't contain any live virus. It's virtually 100% effective in preventing precancer and cancer of the cervix caused by HPV 16 and 18. And the preventive effects is expected to last at least 4.5 years and probably much longer. Next slide. Here's an example of a patient with cervix cancer we have treated. It's a cross-section of the pelvis. This is the pelvic bone. This is the cervix area, and we treat the lymph nodes and the cervix at the same time, avoiding the bladder and the intestines in the front. Next slide. Here's a front view. Again, we're treating the lymph node area and the cervix and the uterus, and the patient, together with chemotherapy, did very well. Next slide. Cancer treatments consist of surgery, radiation, and chemotherapy, and various combinations of these treatments. Next slide. For radiation treatments, we use high-energy X-ray beams in order to kill cancer cells while preserving organ function. We also want to avoid damage to the adjacent tissues. We can accomplish that by using what is called intensity modulated radiation therapy, which is a highly sophisticated radiation treatment. Next slide. Here's the radiation treatment machine called a linear accelerator. Here's a therapist setting up the patient on a treatment table. We use lasers to set up the patient. Next slide. Here's a device in the treatment machine using leaflets to customize the shape of the radiation field. And we can also using the leaflets to modulate the intensity of the radiation beam. Next slide. Here's an example of the different beams we use. We usually use multiple beams to target the cancer inside the body and try to avoid the organs around it. Next slide. Here's another example of that treating brain tumors. Next slide. Besides using multiple fields, we can modulate the intensity of the fields from each direction so that we can deposit the radiation to the cancer areas and to avoid, to minimize radiation dose to the surrounding tissues. Next slide. Here's an example of how we plan the radiation treatments. This is a simple 3 fields, 1 from the front, 2 from the side, and the radiation field is not very customized. We use 6 fields in this planning, and the radiation is more customized. And finally, we modulate the radiation beam so that it can be further customized to this patient. Next slide. And here's an example of the final result, treating patients with nasopharynx cancer. We can deliver the radiation very accurately to the cancer while avoiding the brain and other tissues surrounding it. Next slide. Radiation is usually given as an outpatient treatment. It's given daily, Monday through Friday. Each treatment lasts 5 to 10 minutes. Each course can be as little as 1 treatment or up to 8 weeks of treatment. It's usually painless and does not cause any nausea or hair loss. Next slide. So in summary, prevention is better than cure. Intensity modulated radiation therapy represent a major advancement in radiation treatment. Radiation, along with surgery, chemotherapy, are the last line of defense against cancer. The second line of defense is early detection and screening, but the most important and the first line of defense against cancer is prevention for those cancers that are preventable. Next slide. So I would conclude by giving you 7 tips of cancer prevention. First, don't use tobacco or betel nuts. Next, eat a healthy diet with lots of fruits and vegetables and limit the amount of fat. Number 3 is to maintain a healthy weight and be physically active. Number 4 is protect yourself from the sun. 5 is to immunize against infections that is potential cause for cancer. 6 is to avoid any risky behavior. And finally, get regular medical care. Next slide. Thank you very much.
That concludes our time with Dr. Au. Ladies and gentlemen, please give it up for Dr. King Sing Au from the Island Cancer Center.